Hello and welcome. Today, we're going to get into something that a lot of us have felt, but maybe don't fully understand: nerve compression in the arm. It's one of those things that can be anything from a tiny annoyance to something that really impacts your life with pain and weakness. So, in this explainer, we're going to decode what is really going on when your nerves get put in a squeeze. I mean, we've all been there, right? You wake up in the middle of the night and your hand or your whole arm is just buzzing with that weird, tingly pins and needles feeling. So you shake it out and it slowly comes back to life. Now, usually that's just a temporary thing. But for a surprising number of people, up to 5% of us will get carpal tunnel syndrome. That feeling becomes a sign that something more is going on. It's basically a signal from your body, and today we're going to learn how to read it. So to really get what's happening, I want you to think of your arm as this incredible superhighway. And the nerves, they're the lanes of traffic, carrying all this crucial information, sensory signals, commands to your muscles, from your neck all the way down to your fingertips. And just like any highway, you need that traffic to flow freely. But, sometimes you get a traffic jam, a bottleneck forms, and everything just grinds to a halt. That, right there, is the perfect analogy for nerve compression. Okay, so what is this nerve traffic jam? What's actually causing that tingling, that numbness, or that pain you might be feeling? To really understand it, we need to look at the mechanics of how a nerve gets into trouble in the first place. This isn't just some random thing that happens. It's a very specific biological process with a clear cause and effect. The official medical term for this is entrapment neuropathy, and that word entrapment is key because our nerves, they don't just float around in our arms. They have to pass through these really specific pathways or tunnels. Think of them as tight spaces, usually with bone on the bottom and a tough fibrous ligament stretched over the top. The really critical part is these tunnels can't stretch. They're fixed. So if anything at all causes swelling inside that tiny space, guess what gets squeezed first? The nerve. And this is so important to understand. This isn't something that happens overnight. It's more like a vicious cycle that just builds on itself. It all starts with some kind of constant pressure on the nerve. That pressure squeezes the tiny little blood vessels that feed the nerve oxygen and nutrients. So you get reduced blood flow. The nerve, now starved of that blood supply, starts to swell up on the inside. But remember, it's trapped in that tunnel that can't expand, so the pressure just gets worse. And over time, this cycle can actually strip away the nerve's protective coating and damage the nerve fibers themselves. And that's when those symptoms really kick in and stick around. And these images perfectly show the two most famous nerve traffic jams in your arm. Over on the left, that's the carpal tunnel, right at your wrist. It's an incredibly narrow passage where the median nerve is crammed in with 9 different tendons. It is a very crowded neighborhood. Then on the right, you've got the cubital tunnel at the elbow. This is where your ulnar nerve passes through, the one you hit when you hit your funny bone. And get this, just bending your elbow can shrink the space in that tunnel by more than half. It's no wonder that nerve can get irritated. These are the big two, but trust me, they're not the only places a nerve can get trapped. So let's say you've got the symptoms: the tingling, the numbness, maybe some weakness. How does a doctor figure out exactly which nerve is causing the problem and, more importantly, where the traffic jam is? Well, this is where it gets kind of cool. The process is a lot like being a medical detective, piecing together all the clues to pinpoint the source of the trouble. And what's amazing is that a lot of the time, the diagnosis can be made just from talking to you and doing a physical exam. The investigation usually builds up in these 4 key stages. First, and honestly, this is the most important part, is the patient history. It's your story. Your doctor needs to know exactly where you feel it, when it happens, and what makes it worse. Next up is the physical exam, where they'll look for any visible signs like muscle loss and test your strength and sensation. Then they might use what are called provocative tests. These are specific little maneuvers like tapping over the nerve or bending the wrist that are designed to briefly recreate your symptoms to confirm the location. And finally, if they need more information, they can bring in the big guns like nerve studies or an MRI to confirm what they suspect. Now take a look at this. This picture is really telling. What you're seeing here is called the thenar wasting. Basically, the muscles at the base of the thumb have started to shrink away. This is a classic sign, but it's a late-stage sign of severe carpal tunnel syndrome. It means the median nerve has been getting squeezed for so long that the muscles it controls have actually started to wither. When a doctor sees this, it's a huge clue that this isn't a new problem. It's chronic, and it's progressed to the point of causing real nerve injury. It's a powerful piece of the puzzle. Okay, so the detective work is done. The location of the nerve traffic jam has been found. The next logical question is, how do we clear the road? How do we free that nerve and get the signals flowing smoothly again? Well, the approach can be anything from simple changes in your daily routine all the way to surgery, but they all share the same fundamental goal: take the pressure off the nerve. Generally, treatments fall into one of two buckets, and you almost always start with the non-surgical options. This is the first line of defense. Things like splinting, especially at night, can keep your wrist or elbow in a nice neutral position to give the nerve as much room as possible. Physical therapy can teach you special exercises to help the nerve glide better. And of course, modifying your activities to avoid whatever is making it worse. Corticosteroid injections are also a powerful tool to reduce swelling right at the source. But if those things don't work, or if the symptoms are just too severe, then it's time to look at the surgical options, which are all basically different types of decompression surgery. Now, I know the idea of surgery near a nerve can sound a little intimidating, but these procedures are often incredibly straightforward and have a really high success rate. What you're seeing here is a typical marking for an open carpal tunnel release. It's just a small, very carefully placed incision right in the palm that gives the surgeon a direct, clear path to the source of the problem, that tight ligament that's acting as the roof of the tunnel. And this right here illustrates the whole point of the surgery. It's genius in its simplicity. The entire goal is to cut that tight band that's squeezing the nerve. So for carpal tunnel, the surgeon carefully divides the transverse carpal ligament. The second that ligament is cut, the tunnel just springs open. It immediately creates more space and takes the pressure off the nerve. And the effect can be almost instant. It's amazing. Patients often say that the constant nagging pain they've had for months is just gone right after the surgery. That's because blood flow rushes back into the nerve almost immediately. All right, so we've talked a lot about carpal tunnel syndrome because it's the most common one, but it is so important to understand that it's just one of many potential traffic jams. Your arm has three main nerve superhighways: the median, the ulnar, and the radial nerves, and each one of them can get compressed at a bunch of different spots along its path from your shoulder to your hand. This little chart gives us a fantastic bird's eye view of what's going on. We've talked about the median nerve getting trapped in the carpal tunnel at the wrist, causing issues in your thumb, index, and middle fingers. But look at the ulnar nerve, your funny bone nerve. When it gets pinched at the elbow in the cubital tunnel, the symptoms show up in your pinky and ring finger. And then there's the radial nerve, which is totally different. When it gets compressed on the forearm, it usually causes more of a deep, aching pain on the top of your forearm and weakness when you try to lift your wrist and fingers, without as much of that classic numbness. Each nerve creates its own unique symptom map that acts like a clue pointing right to the problem area. So if you take away just one single thing from all of this, let it be this: the tingling you feel in those specific fingers, the ache you have in that particular part of your forearm, the weakness you feel when you try to grip something. None of that is random. It's all incredibly specific. These are signals that are directly tied to the anatomy of a particular nerve at a particular spot. They follow a predictable pattern. And the best part is, because we can trace these signals back to a specific cause, they are very often treatable. So we'll end on this question. Your body is talking to you all the time. Numbness and pain, they aren't really the problem itself. They're the alarm system. They are signals pointing to an underlying issue. Think of it like your body's check engine light. So the next time you feel that tingle or that ache, don't just ignore it or shake it out. Pause for a second and ask yourself, what is my body trying to tell me? Because understanding that message is always the first step toward finding the solution.